Singaporeans can be assured that MediShield Life premiums will remain affordable and within their Medisave contributions. Health Minister Gan Kim Yong gave this assurance at an event to mark World Blood Donor Day.
Health Minister Gan Kim Yong said the new national insurance scheme, MediShield Life, is a very important shift in Singapore's healthcare financing framework. Mr. Gan said that the MediShield Life Review Committee had made some very impactful recommendations, such as the removal of the lifetime claim limit of $300,000. Also, proposals to increase claim limits and reduce co-insurance will allow one to claim more from MediShield Life, and that means paying less for one's medical bills. With more benefits and a higher payout, premiums will rise. But Mr. Gan has stressed that premiums will be kept affordable for all segments of the population.
For the older Singaporeans, particularly the pioneer generation, I think the pioneer generation package has been announced recently, and this will ensure that our pioneers don't have to worry about MediShield premiums. Secondly, for the middle to lower income Singaporean families, there will be a permanent subsidy structure to ensure that they too will be able to afford the premium for the family. And for the middle and higher income Singaporeans, the additional 1% Medisave contribution will go a long way to help them cope with the MediShield premium.
For example, Mr. Mutu earns $5,000 a month as a project manager. Mrs. Mutu is a homemaker and they have 2 children and 2 elderly non-pioneer generation parents. The current premiums for each adult is $9, $4 for each child, and $38 for each grandparent. The total amount is $102 per month. With transitional subsidies, it's $11 for each adult, $5 for each child, $39 for each grandparent, and the total is $110 per month. The premiums without transitional subsidies but with premium subsidies is $21 for each adult, $9 for each child, and $41 for each grandparent. The total is $141. Increase in premiums for the entire household, excluding transitional subsidies, is $39 per month. The 1 percentage point increase in employers' Medisave contribution for Mr. Mutu will come up to $50 per month, which covers his household's premium increase of $39. Mr. Gan said the transitional subsidies offered over 4 years by the government will help Singaporeans ease into MediShield Life. These subsidies will be tiered. In the first year, 80% of the premium increase will be subsidized, followed by 60% in the second, 40% in the third, and 20% in the fourth year. So, for example, in the first year, if the premium increase is $10, the subsidy will amount to $8 and one pays $2. Mr. Gan added that the government will work out a special scheme to provide additional support for those who still require further help. The Health Ministry will finalize the government subsidies and provide details at the end of the month.